A successful interview requires you to do your research beforehand. And it's not going to be a heavy research. You're just looking at the patient's chart and getting your information before you call your patient into the room. Find out why they're there. What kind of appointment is this? When was the last time they saw the provider? Do all of that before you bring them in, and that's definitely going to assist you in interviewing the patient more thoroughly. You want to request the interview. Ask the patient, is it okay to speak to them about their medical issues? And with this, when you're asking, you're also making them feel more comfortable. The more relaxed the patient is with you, the more the environment will give them the ability to be able to share more with you. And ultimately, that's what we want them to feel. We want them to feel comfortable. We want them to feel welcomed, and we want them to feel the trust that their concern is being heard and that they will be treated. Lastly, make sure that you're ensuring privacy. With the privacy, we want to use closed doors. If you work in a facility that just has a curtain and that's the only bit of privacy you have, then maybe you can lower the tone in your voice just to make sure that that patient still feels that confidentiality. We want to eliminate any interruptions. So we don't want to tend to other patients while we're with that patient. Doing that will not allow that patient to feel that level of trust, and you may not get the real reason why they're being seen that day. Be respectful with sensitive topics. Watch for nonverbal clues. Watch for your own nonverbal clues. A lot of what we say is in our face and our body mechanics as well. And so you may hear some things that you've never heard before, and you don't want your patient to feel uncomfortable with sharing their information with you. So watch your verbal and your nonverbal clues. Do not diagnose. That is not in our scope of practice. It's something that we never do, nor are we allowed to give an opinion. Patients might ask you, what would you do if you were in this position? What medication, if any, do you recommend for this? Out of our scope of practice. Anytime they ask us for anything along those lines, it is perfectly okay for you to refer them and their questions to the provider. Remember your scope of practice, and no matter what state you live in, diagnosing for a CCMA or our opinions for a CCMA are not within our scope. Formulate a general picture of signs and symptoms. And when you're doing that, just like we learned the other day, we learned about anatomical position, we learned about the quadrants in the stomach, and I gave a really good example about the appendix. And if the appendix was an issue of pain, knowing the location of the appendix and listening to the patient describe what it is that they're experiencing may help us to ask even better questions as we go through to help the doctor have an easier way of analyzing and diagnosing that patient. So keep in mind, the better we do in our interviewing, the better it is for the provider, and the easier it may be for the provider to diagnose. Lastly, ensure understanding. Repeat back what it is that you've heard, and that will also allow the patient to add even more information to the interviewing if necessary. You could never have too much information when you're documenting chief complaints. I just want to reiterate that we leave our biases and our judgments out the door. Everything that we document is going to be in the patient's own words. Interviewing successfully will also require that you ask open-ended questions. So it's necessary to ask questions that give you more than just a yes or no. We want to try to pull things out of the patients. Are they experiencing pain? We don't want just a yes. We can ask them on a level of 1 to 10, how much pain are you experiencing? How long have you been experiencing this pain? Where is the pain located? Has it always been located in that area, or does it move to other areas? Is this something you've experienced before? We can just keep this going days and days and days with questions, but you want to ask open-ended questions that allow you to get better answers, again, for the provider to help evaluate and diagnose that patient. Mirroring and restating also going to be important, and that again is repeating what it is that you've heard, and that's going to help with clarity. Reflection, very similar, encouraging the patient to evaluate the situation or have an opinion. And then the last one is going to be clarification. Summarize the information collected from the patient. Again, giving that information back to them, making sure that we've documented and we've heard correctly, and that will help clear up any confusion along the way. So these are all really good tasks that you can add into your interviewing skills. And as you interview, the more that you interview, your mind will be able to generate better questions, better open-ended questions, building that trust with the patient. So hopefully they overshare. And again, remember, only documenting in their words.